Do you personally know anyone who's been diagnosed with Alzheimer's?
Yes.
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 I do not.
What symptoms do you think of when you think of Alzheimer's?
Memory loss.
Yeah, forgetfulness, confusion, dementia.
Probably forgetfulness more than anything.
Loss of memory.
Do you know what can lead to Alzheimer's?
It's genetic, isn't it? No, no.
So I am part genetic, and then kind of what you put into your body.
Something to do with probably degradation of neurons.
Do you know any of the treatments for Alzheimer's?
I don't.
Are there any treatments? None that don't come from Grey's Anatomy.
So what brings you in today, Mrs. Beavers?
Well, I just haven't been feeling myself lately.
In what ways?
My family says that I've changed.
But you haven't noticed any changes?
Well, my children and husband say that I've been asking the same questions repeatedly and that I've seemed withdrawn. And I've been losing more things than normal.
Mm-hmm.
I can't remember books for my book club that I just read, and I've been having trouble balancing my checkbook.
Okay.
What else am I having trouble with? I can't think. I feel so disorganized.
I'm sorry, I'm having trouble finding the right words.
That's okay. You've given me a pretty good idea of your symptoms. I do want to do a few tests to try and figure out what's going on with you. First, we're going to set up an MRI to make sure that we can rule out a small tumor or a stroke that might have occurred that would cause this. Today, let's run through some memory and attention tests to sort of see exactly what functions you're having problems with and get a better idea of that.
What did she just say? I've already forgotten the first part.
Okay, that's fine.
Hi, Mrs. Beavers. It's nice to see you again.
Hello.
I have all your test results. The MRI came back ruling out a stroke or tumor, so that's good. However, after conducting the other tests, I believe you might be in an early stage of Alzheimer's disease. Do you know what Alzheimer's disease is?
I guess I've heard of it, but I don't really understand it.
Well, it's the most common form of dementia. Dementia means loss of memory and other cognitive abilities. Alzheimer's is a progressive disease, so over the next few years you will notice some of the symptoms you mentioned before will worsen, including the memory loss and the difficulty reasoning and the behavioral changes.
Well, how did I get this?
Well, the risk factors aren't well known. The most common risk factor is, increasing age. So about 95% of the people with Alzheimer's disease are over the age of 60. So it isn't uncommon for a 65-year-old like yourself to develop the disease. It is likely due to a mix of factors, though, including genetics, environment, and lifestyle. However, this form of the disease is not genetically based, and so don't worry about passing it on to your children.
I mean, I guess that's the only real good news here. Well, what is even happening to me? Like, what's going on in my body?
Well, specifically, the neurons in your brain are slowly dying off, and we aren't sure exactly why. In your brain, there's an increased amount of deposits of a protein called amyloid, and it forms plaques and tangles when it's abnormally wrapped, and those are called tau tangles. And this part means that parts of your brain are no longer communicating. Once the neurons stop communicating, they die off, which is why your symptoms will get worse over time. The area most affected is called the hippocampus, which is responsible for a large portion of memory. That's why you're having trouble remembering things and staying organized.
Okay, well, thank you. I think that helped me understand, but what do I do now? Are there treatment options available?
Well, as of now, nothing we know actually stops, prevents, or reverses any of the symptoms of Alzheimer's. But there are things we've identified that can slow the progression, so we can talk about some of those things now.
Please.
Okay, Ethel, so the doctor said we're going to try and give you Aricept, but if that doesn't work, we could let her know since there are 2 other drugs we could try.
What will it do?
It's going to help your mind stay organized. Different parts of your brain will be able to communicate more easily. Well, what's that other bottle? This one is called Namenda. It's supposed to help communication throughout your brain in another way. The R sept helps with chemical that makes it happen, and the Namenda helps a bunch of the cells that actually do some of the communicating. The doctor says that taking both will help with the problems you've been having.
Well, will it make me better?
No, Ethel. Don't you remember the doctor said that there isn't a cure yet, but we can help slow down the disease. Look what else I got you. It's a calendar. You can hang it up in your refrigerator. This way we can make sure that you can always know what you've got to do. We can write down little reminders about all your appointments, when you need to run errands, when bills need to be paid, and every time you do something, we can check it off so you can keep track. And every day I'll come over and we can go for a walk around the neighborhood together. You remember the doctor saying that exercise can help too, right? And I found some exercise videos that we can do together when the weather's bad. I know it's been hard. It's been hard on all of us watching you have trouble lately. I found a support group that meets right down the road that helps patients and families get through this.
You mean there'll be other Alzheimer's patients there too?
Yep, it's not going to be easy like the doctor said, but I think that going to the group and talking to other people will help you get through it. They have meetings for just family members too, and I'm going to go to as many as I can. I want to know what we're dealing with and learn from others who have already gone through this. So that can help us as much as possible.
Okay, well, let's go for a walk.
How would you define asthma?
Not being able to breathe well. When you exercise and you are out of breath quickly. Like trouble breathing.
Trouble breathing.
Do you know what some of the causes are?
Pollution.
Being overweight, obese.
So smoking. Maybe it's genetics.
If the air quality is really bad.
Do you know any of the treatments?
No idea.
I know that you have an inhaler.
Inhalers?
I know a lot of people use inhalers before they work out. Other than that, no, not really.
Okay.
I am having difficulty breathing lately. The cold air is making it harder to breathe as I work out. I continue to ignore my symptoms even though they are getting worse. I woke up in the middle of the night due to shortness of breath. I try to go back to sleep, but I'm unable to. Now I can't even do normal activities like walking up the stairs. I'm still trying to catch my breath. As the weather keeps getting colder, my condition just continues to worsen. I can't ignore this anymore. I need to go see a doctor.
Hey, Anne. Hey. So what brings you in today?
I've been having trouble with my breathing recently.
Well, how would you describe all the problems you've been having?
Well, I've been feeling like I get out of breath really easily lately, and it's harder to get my breathing back to normal. I've been coughing a lot more, but I thought it was just because of a minor cold.
Can you tell me how often it happens, and sort of is it all the time, and when did it start?
Well, it's comes and goes, but it's been pretty consistent. Sometimes I have trouble sleeping because of the chest pain and the wheezing.
Okay, so we might want to run a test for asthma.
Okay.
Do you know if anyone in your family's had it?
I think my grandmother had it.
Okay. Well, I think it's safe bet to run some lung tests and some allergy tests, or to test other things. We'll do some imaging, and from there we'll get a better picture. Does that sound okay?
Yes, as long as you find out what's going on and I can keep training.
Okay, well let's get to it. The allergy test will test for any environmental triggers, and the lung function test will tell us the capacity of your lungs and whether or not they're fulfilling it. How are you doing, Anne?
I'm doing good. I'm still having trouble with my breathing now.
Oh, I'm sorry to hear that. Well, we have your test results back, and we have good and bad news.
Okay, what is it?
So the bad news is that you have asthma, but the good news is that it's treatable.
Okay.
We've classified yours as sports-induced asthma, which is why it's causing you trouble sleeping and difficulties with all the physical activities, especially in the cold weather.
Okay, well, what does that mean? Does it mean I'm going to have trouble breathing for the rest of my life? Will I still be able to train for the marathon?
Although asthma has no cure, we can normally control it by removing some of the environmental factors that trigger it, along with some of the treatment options we have. So why don't we go through all of those. As long as you cut back and use your inhaler, you should be fine. So we can go ahead and talk about the different treatment options and find the best one for you.
Okay. I've now received treatment for my sports-induced asthma. I have a long-term inhaler that I take daily. This is a beta agonist that helps open my airway. I also have a short-acting beta agonist to help me in case of any sudden asthma attacks that require me to open my airway quickly. I have also slowed down on my training so as not to strain my body physically.